Multiple sclerosis. Multiple sclerosis is one of the hottest topic all over the world. For those of you who are preparing for medical licensing, this would be a very hot topic that they will cover, regardless of where you live, in which country are you applying to become a doctor. So, multiple sclerosis is an autoimmune disease affecting the central nervous system. It involves the immunity system attacking the myelin sheet around the nerve fiber, leading to various symptoms such as fatigue, weakness, and cognitive changes. While the cause is not fully understood, the treatment focuses on symptoms management and slowing the disease progression. Regular monitoring and a multidisciplinary approach are the key in management of multiple sclerosis, and it's very effective, remember. So this is an overview of multiple sclerosis, but I'm going to give you a list of the topics that we will cover in multiple sclerosis. The first one, what is multiple sclerosis? Definition. The second one is epidemiology and types of multiple sclerosis. The third one, we will cover the signs and symptoms. And fourth, investigation and diagnosis. The last but not least, the treatment of multiple sclerosis. Okay, multiple sclerosis definition. So we have two definitions. The first one is a chronic inflammatory disease of the CNS characterized by relapsing and remitting or progressive neurologic symptoms due to inflammation, demyelination, and axonal degeneration. If you want me to make it very easy and make your life very easy, just remember this. Demyelinating disease of the CNS affecting two specific place: brain in our body and also spinal cord in our body. So demyelinating disease of the CNS affecting brain and spinal cord. Just remember this. So let's talk about the epidemiology. Globally, it affects around 2.5 million people. Onset is mostly in younger age, 17 to 35. Female are more prone, three times more than male. Genetic plays a role for those of you who carries HLA DRB1. Environmental factors. Multiple sclerosis more common in region with the less sun exposure. Less sun exposure lead to less vitamin D. So in terms of environmental, less sun exposure, less vitamin D. So the countries like Europe, Canada, US, New Zealand, and Southeast Australia, and any other country that they have less sun. The second environmental factor, that it has a link with a virus which is called Epstein-Barr virus. So here we cover the epidemiology. Let's talk about the types of multiple sclerosis. It has four types, but the first one, relapsing and remitting, is the most common. Remember, secondary progressive multiple sclerosis, primary progressive multiple sclerosis, progressive relapsing multiple sclerosis. These are the type, but these are how they affect the body and how they progress. Remember, relapsing and remitting is the most common one that we will cover in this lecture. Okay, multiple sclerosis sign and symptom: numbness, visual disturbance, especially optic neuritis, weakness, spasticity, diplopia, impaired gait, vertigo, bladder dysfunction, especially urge incontinence, breast reflux is very characteristic, nystagmus is very characteristic. And this is a picture that will cover everything basically. Multiple sclerosis sign and symptoms. For this, remember this sign is a special sign called a hermit sign. When the patient flexes his neck, there will be an electrical or electric shock sensation radiating to the limbs, upper limbs, and also lower back. Utah phenomena, when a specific symptoms get worse when the temperature is warm, like in heat, the optic neuritis gets worse. This is Elhermit sign. If you see the electrical shock is radiating to the limbs or upper limbs. Multiple sclerosis investigation and diagnose. So basically, if I I make your life very easy, so MRI is the golden standard, the best first imaging. And the cranial MRI is more sensitive than spinal MRI. Confirmatory investigation will be the lumbar puncture CSF because oligocolonal band is 90% positive and there will be an increase in IgG concentration. Now, to summarize it and to make it very short for you guys, MRI is best initial test and golden standard test. If they ask you about this, just go for MRI. This is a healthy brain, and this is a brain with a multiple sclerosis lesion or plaques. The second test that you need to do is lumbar puncture is a confirmatory test, and you will find oligocolonal 90% and IgG concentration high. Multiple sclerosis treatment. So in this case, I'm going to talk about three parts of the treatment, and then I will talk about the symptomatic treatment. So if it happens acute, in acute multiple sclerosis, how do you treat? The best treatment for acute multiple sclerosis is steroid, IV methylprednisolone, 1000 milligram for 3 to 7 days, no need for tapering, or oral prednisone 1000 to 1250 milligram for 3 to 7 days, no tapering needed. If they fail, the next will be plasmapheresis. The the best long-term treatment is disease-modifying treatment being done by interferon beta, glatiramer, and natalizumab. Now, for long-term treatment, there's the vitamin D 4000 international unit. Just remember, acute, long-term maintenance therapy, and also long-term vitamin D. Now let's talk about the symptomatic treatment. So, what if the patient has a spasticity? How do you treat a patient with a multiple sclerosis who has a spasticity? Baclofen is the best choice. We have another choices that I'm going to write right now. Tizanidine, dantrolene, benzodiazepine, and also botulinum toxin. But the best one will be baclofen. Remember, this will be in the exam. If the patient is fatigued, amantadine, modafinil, and methylphenidate. What if the patient has pain? For pain, since it's CNS, is affected, tricyclic antidepressant, carbamazepine, gabapentin. This pain is neurological pain. So depression, remember, it's one of the most common psychological issues that will be associated with multiple sclerosis, SSRI, and lithium would be a good choice. Usually lithium for mood disorder. Urinary incontinence mostly will be urge incontinence. So oxybutynin and mirabegron is the best choice. What if the patient has constipation? Easy. High fiber, stool softener, laxative. What if the patient has sexual dysfunction? Easy. Sildenafil, tadalafil, and verdanafil. Just choose one of them. Okay, so let's do some MCQ or multiple choice question. So we have a 32-year-old female presents with the symptoms of blurry vision, fatigue, weakness, numbness, and difficulty walking. On neurological examination, she has brisk reflex and evidence of nystagmosis. So basically, she has all the signs and symptoms of multiple sclerosis. Is it Guillain-Barré syndrome? Chronic fatigue syndrome? No. Multiple sclerosis? Yes. Is it myasthenia gravis? No. Look, the patient is 32. We said 17 to 35 and female. So basically, all the picture of multiple sclerosis. The presented symptoms such as vision changes, weakness, numbness, and difficulty with coordination are classic sign and symptom of multiple sclerosis. Breast reflex and nystagmus is also common, and 32 female. So basically, it's 100% multiple sclerosis. Let's do another multiple choice question. So we have a multiple sclerosis. So what is the golden standard for diagnosis of multiple sclerosis? MRI, number puncture, blood test for myelin protein, electromyography. We all know this. What is the answer? The answer is MRI. A. According to the Canadian guidelines, MRI is the best diagnostic tool for detecting lesions in the brain and spinal cord that are characteristics of multiple sclerosis. So the best, first, and golden standard imaging is MRI. MCQ 3 or multiple choice question number 3. Which of the following is diagnostic option for confirming multiple sclerosis? We have the diagnosis, we did the imaging. How to confirm it? EEG, cerebral spinal fluid, density scan, echocardiography. We all know what do we do? Lumbar puncture, CSF analyze. CSF analyze can help the presence of specific abnormalities suggestive of multiple sclerosis. What is those abnormalities? 90% presence of oligoclonal band and increased IgG antibody in CSF. If you have it, then you have multiple sclerosis. Okay, multiple choice question number 4. A patient with a non-multiple sclerosis presents with an acute relapse characterized by worsening of neurological symptoms. What is the most appropriate treatment for this acute multiple sclerosis attack? For acute, what do we do? Steroid, physical therapy, antidepressant, vitamin D? Which one? Steroid. You are right. For acute attack, we always use a steroid. In case of acute relapse and multiple sclerosis, steroids are commonly used to reduce the inflammation and speed up the recovery. Remember, if it doesn't help, the next option will be plasmapheresis. The last multiple choice question. What is considered a long-term treatment option for multiple sclerosis aimed at reducing relapses and disease progression? So is it the pain medication or disease modifying therapies or antibiotics or herbal supplements? We did talk about this, which is the disease modifying therapy. And we do know about the medication too. It is used for the long term management and it decreases the frequency and severity of the relapse and slow down the disease progression and recommended by the Canadian guideline. Remember the names? Okay, thank you very much for watching, everybody. This video is prepared by and presented by me, Dr. Muhammad Nasiri Jallah. These videos are designed and prepared for Afghan female medical students, medical doctors, nurses, and healthcare workers who are deprived from their basic right, which is to study and save life. And also, it is designed for those who wants to do their medical licensing exam. So I hope you guys found this lecture fruitful, informative, and educational. Thank you very much. I use two references mostly, which is Toronto Note and UWorld. I use a lot of references, but these are the most common references that I use. Thank you very much.